living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
Have you heard of direct primary care? It's a relatively new healthcare model that's gaining popularity in the United States and could change the look of healthcare for providers, patients, and other players in the healthcare system. Welcome to Healthy Living for Life, a show dedicated to helping you do just that. I'm Janet Whitmoyer, your host. We'll learn about direct primary care after these messages. Stay tuned. Welcome back to Healthy Living for Life. In the past decade, the direct primary care model has grown from a handful of practices to hundreds of practices serving hundreds of thousands of patients over the 48 states. Joining us today is Dr. Michael Tracy and Doctor of Nursing Practice Cole Whitmoyer, who both practice direct primary care. Thanks to both of you for being with us today. The first question that I'm going to ask is a basic one, and Dr. Tracy, I'm going to ask you to answer this one if you would. Can you tell us what direct primary care model is?
Sure. So direct primary care is what it sounds like. It's a direct relationship between patient and the primary care provider. And so it means that the patient and the provider are at the center of the healthcare delivery model, and it doesn't involve other parties deciding what's appropriate and what's not appropriate. It's really between the patient and the provider.
Okay. And direct primary care is a relatively new model. Can you tell us a little bit about the history and how it came to be?
Sure. For me, I first heard about it probably about 2014, and I was asked to be part of a hearing on why are healthcare costs so high in Wyoming and what can we do about it. And I started learning about direct primary care, and really I trace what we're doing back to what they did in Seattle through a group called Q-Liance, and they had a really great success with the movement out in Seattle with Q-Liance. There are other practices like Atlas MD in Wichita, Kansas that have been successful. But for us, what we're trying to do is keep it a pure direct relationship between the patient and the provider, and not involve some of the other features of what you might hear of as concierge medicine. So I think that for us, the model came to be because there were providers probably back in the 90s or sooner who feel the same pressures that are felt today. You know, you have to see more patients with decreasing reimbursements and less satisfaction and joy. And I think that the whole direct primary care movement is an effort to just bring things back to that relationship between the patient and the provider.
And I know that you mentioned you started this back in about 2014. Cole, I wanted to ask you, how long have you been practicing under the direct primary care model?
Yeah, we're relatively newer. We've been open for just over 1 year. This last April was 1 year. So.
Okay, so you're both getting some experience under your belt as pioneers, it sounds like. The next question is probably one that's going to be on the viewers' minds right off the top. Does direct primary care take any kind of health insurance? So Cole, do you want to start with that one?
Yeah, and Dr. Tracy just jump in because he's the guy that got me going on all this. But and like he just prefaced for that, we do not take any insurance, especially in the direct primary care model. Now, there are some hybrid practices that practice two different models, the fee-for-service and direct primary care, but direct primary care itself, we don't take any insurances. Hence why, again, Dr. Tracy had stated direct to the provider.
Okay, so I know that there is a fee involved then, since there's no insurance. How often does a patient pay the fee, and is it before or after they receive the patient receives care? Dr. Tracy?
So so the answer to that is probably a little bit of it depends, but most of the time it's a monthly membership fee so that people can just budget it, like a gym membership or anything, any other membership that you're part of. But we have some people who prefer to pay, a year at a time. And the question about, do you pay before or after you receive care? You pay the same amount whether you don't come at all or whether you come daily for a while, or so the amount that's paid doesn't vary by the amount that we see you in the office. So another thing I was going to mention about taking any kind of health insurance, like Cole said, there are some hybrid models, and I think it's important to distinguish between concierge medicine and direct primary care. So in Cole's model and our model, we don't have a tiered system. Everybody pays the same price, and the fees, I think, are very, very reasonable. In a concierge practice where you accept insurance, the concierge part of it is you pay extra to have the doctor or the provider's cell phone number and to be able to have good after hours communication. And so for us, we want everybody to have the same access. We don't want to have a tiered healthcare system. And so that's kind of the difference between those two. Okay. In the last minute that we have for this segment, I was wondering if you two could tell us a little bit about what the most common types of services that you provide in direct primary care. What do you offer? Yeah, go ahead, Cole.
Yeah, I think, for the most part, it's every primary care thing from acute illnesses to chronic diseases, heart disease, diabetes, thyroid, kids illness checks and stuff like that. But the big thing, other services that we really set ourselves apart from is the 24/7 access that Dr. Tracy touched on. Also, we get wholesale pricing for labs, x-rays, procedures. It's literally pennies on the dollars for those types of things, as well as you get the time, so extended visits, unlimited visits. Our visits are 30 minutes to 2 hours, depending on what we need. So those are some of the extra services.
Okay. We need to take a pause right now for a few commercials, but when we come back, we will be talking more with Cole and Dr. Tracy about the pros and cons, and later we'll be discussing how the model might work for you if you're interested in participating. So stay tuned. Welcome back to Healthy Living for Life. As the direct primary care model gains popularity, there are others who see flaws in it. Dr. Michael Tracy and Doctor of Nursing Practice Cole Whitmoyer are still with us. And obviously, the two of you are advocates, otherwise you would not be practicing in this model. So I'd like to know what you feel, Dr. Tracy, I'm going to direct this one at you, are some of the benefits as a provider for this practicing in this model of care?
Well, sure. I think one of the biggest benefits is that it puts the patient back in the center of the healthcare relationship, and that's the key. So if you can deliver care in a way that meets the patient where they want to be met, then that's a great thing. And so to me, the benefit is that we don't have to define healthcare encounters the way they are in the fee-for-service world, where somebody has to come check in and then have an E&M code generated for a visit. There are times where if somebody's at work and they have a question, we can get a hold of them on the phone so they don't have to miss work. And, so we can do telehealth, we can do phone call visits. And when people do come to the office, it's generally a very efficient experience, without a lot of people waiting. We can spend as much time as we need. So I would say the biggest benefit is just putting emphasis back on the relationship between the provider and the patient, instead of having to focus on the relationship between the insurance company and the patient and the provider.
Okay. And Cole, adding on to that, what do you see are some of the benefits for your patients who are receiving the care in this model?
Yeah, I think one of the big benefits, and I always kind of put it into about 3 words: accessibility, affordability, and flexibility. You have access to the clinic, like Dr. Tracy said, 24/7 access. We're flexible. We can do phone, we can do in office, you can text message us anytime. And the affordability, most practices are offering a service for what we consider, I always use this phrase, less than or about equal to a monthly cell phone or cable bill. You can have complete access to your doctor, your nurse practitioner, your whoever your provider is. And so I think those 3 qualities there, and like Dr. Tracy touched on most of them, are, just a great thing for our patients, and they really love it, and they love being heard and having time.
Okay. Dr. Tracy, what would you say is the biggest challenge that for you when you switched to the direct model of care from other types of practice?
Sure. Yeah, I think there are challenges in switching to a new model. I think it starts with resistance from the current fee-for-service system. There's a lot of people that aren't afraid to go out and say things about a practice model that they know very little about. And I think that's true for people in the healthcare field and for some legislators. And I think once people actually look at the model, it makes sense. So for me, it's been a challenge, but it's been a challenge that I think we've accepted to try to get out and educate people about why this is a system that can affordably meet the primary care needs of communities like Powell, Wyoming, and Billings, Montana.
Okay. And I know we talked earlier about some of the services that you provide under the model, and obviously there are services that you can't provide. What do patients do if they need a service that you can't provide under your model of care? Cole, why don't you take that one for us?
Yeah, well, again, it's the patient's choice, but we always recommend that the patients have some sort of catastrophic coverage over the top of them in case, we always say, God forbid, your arm's hanging on by a thread. I'm not going to be able to put that on and your life's in danger, so you need to go to the ER. So having some coverage for surgery and stuff like that is, something that we would recommend to our patients. We can't do everything, but we like to say we can do about 80 to 90% of things, but there are those times when you are having, a need that's greater than us, and we really recommend that you have something overarching to help you out with that.
Okay. So if a patient does need the care that is not involved in your service, like a lab service, how does that work? Because usually insurance might help pay for that. How does that fall under direct primary care for those costs involved in those services? Dr. Tracy.
So people can still use their insurance, and we, like Cole alluded to, we really encourage people to have insurance. So if we order, large ticket items like some lab work and radiology studies, or sending somebody to a specialist, they can still use their insurance for that. And we have people who have Medicare and Medicaid who can still use those for seeing other providers and for having their other needs met, but not for payment of direct primary care.
Okay, that's really good information to know. I kind of wanted to switch just a little bit. With a big issue with providing health care is that physicians are feeling provider burnout. How do you think direct primary care helps with the burnout? And Dr. Tracy, since you've been in practice longer, I'm going to let you answer that in the last 30 seconds we have of this segment.
Well, I think if you can have a practice where you're meeting people's needs, that really makes it a lot less stressful. But I don't think that direct primary care practices are immune to burnout. So you still have to pay attention to your life and your lifestyle, and hopefully have a partner or partners so that you can take a break. But I think that having patients who are satisfied because they can get their needs met is very helpful from a provider point of view to having at least that portion of it not contributing to burnout.
Okay, great. We need to take another break now. When we come back, we will be looking at how you might be able to become a direct primary care patient if this information is helpful to you. We'll be right back. Welcome back. We're still talking with Dr. Michael Tracy and Doctor of Nursing Practice Cole Whitmoyer this morning. The one thing I wanted to ask you, Dr. Tracy, is what about providers in rural or less populated areas? Do you think the model makes sense for them?
Yes, I do. So we're in Powell, Wyoming, which is about 6,000 people, and Cody is probably 25 miles away with closer to 10,000 people. But we have people from all over the Bighorn Basin, and in fact, all over Wyoming who are members of this practice. And so it's the distance traveled is only an issue if you have to go physically see your provider every time you have an encounter. But if it can be done through texting and phone calls and that type of thing, which most of medicine can be, then I think it makes perfect sense for rural areas. So I think it's a rural, urban, and suburban model that is really can have success in all areas of the country.
Okay. And Cole, adding on to that, what would you say would be the ideal patient for the direct primary care model?
Yeah, what we usually say in direct primary care is that anybody is an ideal candidate for direct primary care. And like we kind of touched on before, anybody who likes having time with their provider, anyone who likes lower cost health care, and people who enjoy just being heard and getting all their needs met when they need them met. I think I think it's for anybody. Insurance, no insurance, high deductible, no deductible, whatever it might be. So, and I know Dr. Tracy has told me quite a bit about this too, so he might touch on it.
Yeah, I think the best example of the ideal candidate was answered for me when I heard a direct primary care provider in North Carolina named Brian Forrest, and he told a story about how he kind of knew that he had done the right thing by doing direct primary care when he looked in his waiting room and he saw a man that he knew to be homeless sitting next to a man who he knew to be extremely wealthy, worth millions and millions of dollars. And they were just sitting side by side in the waiting room. Just an amazing story.
Yeah, that's pretty cool. So what would your best advice be to helping somebody who might be interested in this model looking for a provider? Cole, can you give us some help on that?
Yeah, I mean, there's a few different ways. There's a couple of good websites out there that have a bunch of DPC practices on them, like DPC Frontier. I know that's a great way. They have a map of a bunch of different DPC practices across all of the states. They can look in their area and see if there's one around. I'm sure if you're in the area in Montana, just give us a call here, give Dr. Tracy a call at 307. I'm sure that they'd be more than happy to direct you, because that's what they want to do, is get you into a practice that makes sense for you.
Okay. And Cole, I'm going to stay with you. Can you tell us what a typical appointment would be like if somebody came in and you were to see them? How would that look for them?
Well, you're basically looking at it right now. I'm sitting at the front desk here, and my computer's in the window here where people come up and they just greet me here. And I'm sitting at the front desk, and we basically just go back, have a little introduction. There's no wait time. You just walk right on through into the exam room, or we have a little conference room that we go into too without an exam table. But we go there and we just start basically chatting and kind of take a whole hour to see what your needs are and do the things that we need to do and get the things done that we need to get done. And okay. It's pretty easy. It's pretty simple, and that's the way we like it.
Dr. Tracy, I'd ask you the same question. Is that a similar process for you, or what do your patients experience when they come to visit you?
Yeah, no, I think it is a similar experience, and there are some people who want to stay for a long time, and there's some people who want to just come in and have their need met and get out. So I think that's the efficiency of it, and doing what the patient prefers is probably the most important part of it. And then as a provider, it's also nice that I can just sit down and document the note, what was said, what we did in a way that doesn't involve the note bloat of the rest of the fee-for-service medical world, where an 11-page note is generated when somebody goes to an urgent care center for a cold, and that's so it's nice to be able to just to document what you need to document without having to jump through a lot of hoops for somebody besides you and the patient.
Okay. In the last minute that we have, I'd like to ask both of you what you think the future of direct primary care is. And Dr. Tracy, I'll start with you.
Well, I think the future is, I think we've kind of hit a critical mass, and there's a lot of momentum going. I think that there are a couple of pieces of legislation that do need to be fixed to make people feel even more comfortable with it. And one of them is, right now there's some confusion about whether or not people can use HSA money to pay for a direct primary care relationship. That will open things up quite a bit. I also think that we need to figure out how to get people into this model without making them all be employed physicians, because that's part of the problem with primary care right now, is that all the practices pretty much in this area are owned by hospitals, and that you just don't have the freedom to do the things to take care of patients that we do in this model.
Cole, you have 15 seconds. What would you say?
I don't know. Dr. Tracy says it all pretty well, but yeah, I think that's I'm right behind him on that, and I've learned so much from him, and I just really appreciate that. And I think I want to convey the same sentiment as he does.
Okay. Well, I want to thank both of you for being on the show today. It's been great information. And also thank you for tuning in. Until next time, stay fit, stay well, and stay healthy for life with Healthy Living for Life.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health in partnership with AARP Montana. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting